The Guam Department of Public Health and Social Services Breastfeeding Action Team will be celebrating World Breastfeeding Week 2021 from August 1st to August 7th. This year's theme is Protect Breastfeeding, a shared responsibility. Every day we will have some special advocates and professionals talk about, anything breastfeeding. Today's guest will share why she believes that breastfeeding is a right, not a privilege, and why breastfeeding is a shared responsibility. Let's welcome special guest for Day 4 of World Breastfeeding Week.
Hi, I'm Julie Cunningham, Lieutenant Commander Cunningham. I'm a nurse over at Navy Hospital and then over at GRMC in the ER as well. At Navy, I work in the maternal child unit, so I am an IBCLC, an internationally board certified lactation consultant, and a labor and delivery nurse. I've done that for 21 years now. I've been a nurse for 23, and I'm very passionate about breastfeeding. I love being on the island and just the community that we have that's so supportive of our breastfeeding moms. I feel like this is just such a nice, inclusive place, and we're out there to help everybody and support everybody on their feeding journey. And I've gotten calls from people as far away as Idaho in the middle of the night. It was kind of interesting, and I'm there. You're from Idaho, you're from anywhere in the US, I'm gonna help you. And my motto is that breastfeeding is a right, not a privilege. So I am passionate about providing services for free. I don't care where people deliver or where in the US or in the world they are. I've helped a couple from Russia before via the translator app. So I'm there for anyone. I don't mind helping anyone. And I love our Guam Mama's breastfeeding page. I feel like it's just such a great resource for moms. If they don't want to post a question, they could look up old posts and get some advice that way. And then we have great admins that monitor it for accuracy. So I tell moms, join that page and post your question or look up an old question. And we've got admins that monitor it. And most of the times the admins don't even need to step in. And it's just such a loving community. So I just love being on Guam. And right now I'm in a midwifery program. So I hope to work on this side of the world when I'm done, December of 22. That's the goal. So I'll be doing clinicals this fall at Navy Hospital and then also on Saipan, Rota, and Tinian. At Navy Hospital, I can meet people in person. Most of the time, I give my number out freely to anybody that needs it. And that way, people have access to get help via text. And I tell people most of the time, I can help you via text 90% of the time. We can video chat. I can also meet you in person anywhere. And a lot of people have asked me why I didn't sign up to take patients under TRICARE and start like an actual business. And my answer to that is, again, my motto of breastfeeding is a right, not a privilege. I want people to have access, ready access 24/7 to breastfeeding help. I work in the middle of the night, so I don't mind helping people in the middle of the night. And so I think it's just important that as soon as a mama needs help, and usually moms we are women and we wait till the last minute sometimes to ask for help. So I want moms to have that access to help just as soon as they need it and not have to go through a referral system. So for that reason, I don't work through the TRICARE system or referrals. People can just text me, email me, or call me, and I'm glad to help them. I feel like breastfeeding is a shared responsibility because, as the old saying goes, it takes a village. And it takes a village to help the mom. It takes a village to help that baby grow. And it's up to the community. And I think Guam is a great example of this. It's not faux pas anymore for anybody to breastfeed out in public. And people are supportive of that. I feel like we have that more here than we do in the States. I feel like you hear stories in the States, Target or whatever stores, kind of frowned upon somebody breastfeeding, go to the bathroom, go to the dressing room, etc. Where we don't see that here. And I just love that about the island. I love that about kind of Micronesia in general. So we've got that spirit. And I hope at some point we can get that over to the mainland US, to everywhere, that this is the norm. This is absolutely the norm. And we shouldn't shame women for doing that. So I feel like we need to get everybody on board, whether those the family members, the aunts, the grandmas, the moms, breastfed or not. Like, we know science tells us, evidence-based practice tells us that breastfeeding is the best for the mom and the baby. And here's the science to back it up. So it's important for us as we go forward to really encourage moms to breastfeed and to let them know that they've got the support that they need to accomplish that. And I think definitely here we see that, whereas like I mentioned before, maybe in the mainland, we don't see it as much, but here, definitely I tell all the moms that I educate, this is a great place to have your baby. This is a great place to breastfeed, and then for new moms to start your breastfeeding journey. For the family, I feel like there's so much that family members can do that can be an integral part of that breastfeeding journey for that mom and that baby. Number one, just to be supportive of that. And yes, there's going to be times when it's hard, and to help by preparing meals for the mom, for changing the baby's diaper, for bringing baby to mom, and just really, supporting that mom and letting her know that there's resources out there. And I try to make sure that to all my patients, I hand out flyers. And pre-COVID, of course, when there was tons of family in there, explain to family, like, this is what you can do. Like when we're here in the beginning, kind of help keep the baby awake at the breast. And, if the aunties, the grandmas are in the room, hey, you can help check mom's position and make sure that she's comfortable and get her extra pillows. And sometimes a reminder of like the little things that make breastfeeding easier. Because as moms, we're so in tune to what the baby needs that we kind of sacrifice self. So I get all the family on board and, bring her a drink of water and be there and support her. I think it's so important as a community, to support mothers. And we're having the big latch on. So I've been handing out flyers left and right. And, if you know of any friends, if you know of anybody that would like to join us, and then that way, even moms here understand like this grows and this is such a big thing. And so I feel like, especially for people that are here for a short time, some of our military members, this is a great place for them to have their first babies, because they take that with them and they know that breastfeeding is the norm. And then wherever they go that maybe isn't so breastfeeding friendly, they've got that solid foundation, and then they can pass that on to their friends that yes, this is the norm and this is okay. And they've got that support. So I encourage them, as people that may only be here, if they were military or civilian, for a short period of time, to take that kind of all-encompassing support and spread that wherever they go, whether they'll have more children or not. I would just like moms to know, especially not just here on Guam, but everywhere, that there are so many resources out there, and it's okay to tap into those resources. And as a mom, if you find a resource, and later on, pass that on to someone else, let them know. I'm working on a project for graduate school once I get into the clinical setting to actually do education at each prenatal visit, breastfeeding education. And then that way it's not just all lumped together on one, like at the end of pregnancy. So I want each visit to have that, and I want to make that available to everybody on island. And I want to offer that up to the different, practices and to public health. And then that way I'm sharing that with the community. So I want a program where, each visit you get some aspect of breastfeeding, and then you're able to talk about that. Take this information home, talk to your family members about it. That way when the baby's born, everybody's on board with this and everybody's going to be supportive. Here's ways that the family can be supportive. Here's ways that the dad can be supportive. And here's kind of what to expect in the beginning. And I want to analyze that and see, what are the long-term breastfeeding rates after, implementing this in a practice. So I want to start here, and then I want to try to get that program used at different areas in the United States, and then see what we can do to spread that word and to spread that education. Because I feel like right now women go to the doctor and like we were talking about, moms get just like, oh, you're breastfeeding, that's great, we're going to check a box on your prenatal record. But what else do they get beyond that? And then in the postpartum phase, when mom goes back, what kind of support do they have there? So just kind of ramping up what we have for breastfeeding education. So I want to share what I've got, and hopefully we can share that, all over the island, and then push that out into the mainland as well. Any of our breastfeeding moms, please reach out. We've got Guam Mama's Facebook page, and I'm glad to help people. I give my number out really to anybody. And then we've got Miss Barb over at the Birthing Center. WIC has great resources as well. If you're a WIC mom, they've got classes and they've got peer counselors. So, and again, just feel free to join our Facebook page and post a question. post that you need help, and our admins can definitely get back to you. And then definitely join us for the big latch on Saturday. Thank you for watching.